As a hiad párs jan dhúlag trusig id ME no Island skis lengtanioch, chwala sin volwch fwlwg, mwnatar y dynus.
Hadioch da hwyl yn ei teachum, har oesaid eva tachar, hadioch, uafasoch.
And that's when we then heard this very strange word, ME, myalgic encephalomyelitis, which we'd never heard of. And that was really the beginning of my life being changed forever.
That idea that we somehow consciously have made it happen is insulting. And that's where it gets really upsetting. You just want to thump somebody in the face, really. Well, you would if you had the energy.
Agus fogochtad yn teolich mo fechgyn yn dhŵl fedigach.
Ac yn yw'r gochtad nach le crytyn i ti ddawn. Agus... Hanylad cynnydd dwyn fyd yn ystwywch le symptoms mor rhain nach jaracat corac a hwyddir sy'n a shit a hawn.
Some people are getting an early diagnosis, an accurate diagnosis and good management, whereas other people, if their GP doesn't know about this illness, perhaps doesn't even believe in this illness, are not getting a diagnosis. They're repeatedly going back, being told all your tests are normal, I don't know what's wrong with you, you've probably got depression or something like this. And they are going for months, and in many cases, in this category, even years, with no diagnostic label round them, no help, no management whatsoever. And this is a major scandal for the medical community.
Yn turas sio, as ni torsŵl na steinia na bechgyn smoan sciencel a hana lwyb.
I think one of the most important phrases in this area is, I don't know. And I think anyone who claims to have a clear understanding of what happens when someone goes into an ME state really ought to think twice.
It became abundantly crystal clear that several patients had developed the syndrome, the identical syndrome, but they had developed the syndrome not following a viral infection or another infection, but due to their reaction to a particular form of stress.
Like many doctors, I thought this was either a non-existent illness or was all hysterical nonsense. I was at medical school in the early 1970s. I was taught by my superiors that this was in actual fact hysterical nonsense.
Agus y torsŵl idlisige kouspatjach alapanach a hatakrig leish.
I think anything that helps anyone is good. If you're looking to recover from it, then I'm afraid the recommended treatment currently of CBT and pacing doesn't make sense even in the studies.
Ultimately, I have a pure belief that this is the only effective treatment at the moment. And so that kind of, I suppose, exudes from me and people, take it and get better, What a great result.
Har vi nog snach. Gun upp sig här. Så jag upp sig så. Vi hetinge, vi menar hetinge vi skishan holding eller med en så spegelen. Schön vi vill det goede mag gemor geniale café.
You'd have to smile at someone being so gullible as to take up such treatment.
I feel much more cautious and much more reluctant to recommend to a patient that they should go off and spend, say, £500 on some sort of new talking therapy for ME which has not been subjected to any form of clinical trial.
There's a bit of me almost doesn't dare to hope. There's another bit of me which almost wants to weep with hope.
Ha dochtad yn nilegin ha rad ille gale ME, as ha kritsin gyfele eisiegio. Ha kausbydach ag imig ide, ach ha gahafon ffain am heen ha te gwbyr na gochter teolich. Se lysach ag mikkel ach an y rish.
My journey to getting interested in ME really started back in the mid-90s when I had a partner she had ME and was diagnosed as such by exclusion. And I suppose through living with her, it was the frustration of not being able to help, because I was a general practitioner at the time, that led me to start to look for answers to this problem.
Shenghóid a head volg as an NHS as an ME, lysach o giwl an leirsinach agus lysach o troi echgwrs I grangichte, gyda nach ar cyntiach o syrfach ar sa had, agus chanich dyn I cyntiach cemmer no gorsonnig gyda gad opper. A Michael a cwmal amach gyfel ME y dyfrach y le tre'n chele as y fforstyn enachan far y fel faracyn yn y nochgo, gyharad farac ys yn canar y hypothalamus. Hec eichgyn marwyd corporus chan ei rwyd saich geolys. Hec crytsin gan gafan dynys y les la fi tre'n y gwch ffwlwg an la fi deilig ydym fadachgyn an y doi ydyr ialwydau. Y gwrach o structur yn enachan, ule trochonrag.
In a nutshell, mycotherapy believes that ME is actually a prolonged, often very long, state of fight or flight, but without the triggering emotion being fear. Very rarely is fear the cause. So all the other emotions that are part of human life are maintaining this state of fight or flight, which during that, what happens is the hypothalamus constantly tells the body to keep moving, be on high alert, produce too many chemicals, and that lowers the immunity and produces all the symptoms that were associated with ME.
Ach, ha lysach o'ch cawsbadioch. Ha bechgyn latid ag common yn ME, mo lysach hyn ag nachal diarag science yr yng Nghwlw. Ag sydd yn o cosgys dy lwc ffwlwg y son yn cwr.
There are a number of talking therapies which are advocated by various types of people for this illness. And I think at one end of the spectrum we do have people who have chronic fatigue as a result of psychiatric or social factors, to whom a talking therapy like CBT may well be of help. And there is some evidence from clinical trials that CBT can sometimes be of some help to some people with this illness. I have to say, in our own surveys, which is covering a much wider group of patients, the majority of people have not found CBT to be helpful. Outside the NHS, there are a number of private talking treatments, and by a number I really do mean a number, and new ones seem to appear at quite regular intervals. And these are, I have to say, worryingly quite often accompanied by a great deal of hype and publicity, suggesting that someone has really found the magic treatment almost for ME, and that if you spend £500 on a course of this talking treatment, then you're going to get better for your ME. And to me, that is not something that's acceptable.
Ha Alison agus Kim y diesiach gyda ME agus ydy fi ffwlwg o son ymwydach bliona, ydy yndachw gyffeilltiniad y gael cwrs y lesachw Michael. Chanela mar amas diarafag y fy lesachw Michael y gwbyr nhw'n achel. Ha sy'n dydach o torsŵl ydy chwr a het tafon, agus yn disbyd scienceal agus politicach a het öfrachwch. Cha fi na tori'n scienceal, ach gan lwch ffwlwg sy'n diachan gyma cwtrymach a hawn. Seffer togal yelef a han Kim a ha fwydach an o siarach gwn frisch. Hedde vi ffwlwg le ME son ymwydach bliona, agus cwtioch córain son traumintyn.
When somebody dangles the possible idea of a cure in front of you, it's very difficult to say no. If I don't do it, I could spend the rest of my life wondering what if. But at the same time, dare I get my hopes up? Because to then if I do it and it doesn't work, and I end up dealing with a kind of crushing disappointment, it's then feeling it's worse than back to square one. You're behind square one. You've got to find the energy just to get back up to square one and start rebuilding again. And when the next thing comes along, how are you going to react to it?
Va Alison a nish yn ilan lewis y gwpr na banotrum doedd hannig ME oro fach yn coed bliona. Chat y gobrich I van oorsan. Ha Alison ydy lesach o Michael iachan mar ha an y da fi'n les y deich. Sa I deisiolach o son iachan ys on y darn y turus. Hij het eindige kun je te filmen wat ze lennis een proces. Zo'n gemeen miskichte wat torien giet erp.
Gewoon met mijn jene therapie zo va program met radio met jene dus kun je kunnen bij je van fame zo goed je viajes shows. Hij niet kunt tora raken te maken routinelles. En jullie vinken pischog se bi. Zo gaan we go jingle dus hur mi 3 sessionen wat de graag horen van oogkach van mi Gianna Klebas urges lessen 3 sessions dus je mag mijn oorschen vallen van een heel voorstel raschachi. Dus van mi vallen geen magaridu soort mi hitch mi viach mi tot de gopet zo'n la ham is mi ook een je la ham mi gopet. Dus of course zo'n kan je panel rumme wonen. Giach mi rasch gopet is na words agus charomiach ik mopet daar uit de hierjes van mi vallen ging u avasoch va skis as ma jaun so hole kaal chidoch fallen ging u avasoch van.
Zo'n giet session han Dr. Mikkel a schule Lewis a channige die Allison. Gaan je trekkigen no lessige korpere en loip lessige Mikkel. Tiedig kara get er tiis, agus na hurrit de gritjev aan de berg smoan en Dr. Mikkel. Get a kollas a lessige die skruutig eentjen no lessige kiel aan leersenjach, gaan jelen Dr. Mikkel a skruutig echtri in Islandig, ach tiedig maar a kuusjen a la duw. As joy kan je die Allison agus a kele Ellen, han Dr. Mikkel a se je kolla die Allison as het homer pie, sa lessige a toosjige.
And the name they've given your condition is ME or chronic fatigue, or did they?
They didn't really specify. It was probably ME that. Okay. Sometimes it was more ME at the beginning they would write on blood tests.
I mean, I think you probably know, I don't think there's a distinction between them. They're different in some ways, so there are something different between them, but we tend to clump them all together, chronic fatigue and fibromyalgia and ME, even though they're slightly different, and we just call them fatigue disorders.
Okay.
And you understand the kind of hypothesis we have about the idea that there's this gland in the brain called the hypothalamus whose job is to keep everything in balance. And what I believe, our hypothesis in mycotherapy, is that this gland, when it starts to dysfunction, it's almost like it goes into an overdrive state. So in health, let's say it's supposed to send out 3 signals per minute to the body just to keep it working. It starts to send out way too many, maybe up to 30 signals per minute. So even though you're at rest, it's working your body like you're running a marathon.
That's right.
And that's what produces all the symptoms. My first impressions of Alison on meeting her and her situation were classical of people with ME that I've treated over the years. She's in an interesting situation in that she has a young child and she's also quite far on in a second pregnancy, both of which is going to add to the difficulty in terms of helping her with her ME.
How do you think tydlig or ma jen fader gingen agus nuruten va bring ma jen vi le araman agus kunnen vi le mor an tolliges agus har du think tydlig net au fem de kuatruteen agus han je liksom tegen ferres session die hashin de jenken un hin agus kimmer hashin de lugudane klachker gnyana fem gei.
So Alison can be thinking.
Natuurlijk gra wel at de optoching ek en nou show. Ha mi tekst ja gra is ha mi göntig a klemoran han ruten ha gra ma jenke wel vader kun je nachging agus na dashin kamalschen naar brain kun je nach kron ach kimmer uit jelige glis a hole la na ha kon je gele ruten bisschen tydlig gedaan a klach gach. Hij is een gemaakt ooggezocht, ik ga niet aan een film. Ja, kijk miele ha gra. Hij is leschen had tot bij kantoor gesnoo. Ik heb nog een mee vinken aan de rest.
Ha Kim a school as shirach gun frisch, a chanja chudish en Dr. Mikkel vast get glossigo.
During treatment, energy improves, might go through a spell of some other symptoms, especially because you've had depression, your mood might go down a bit despite you feeling better energy-wise. Then this layer here is, and it happens mostly with women, but it does happen with men, and it's heightened emotions. That during that period, that's time to be mindful, keep acting, but just keep breathing, because it passes. There's nothing really need to be done. And then health is where you become emotional in a normal level way. So, and that's why I say mycotherapy takes happy, unwell people and makes them well and miserable. In terms of the mycotherapy process, what I get you to do in terms of keeping very short notes is to note down when symptoms change. In other words, when they increase or they decrease, and then I help you translate that into one of these emotions if you can.
Right. Having dealt with depression in the past and it's the realisation that you can get these large whooshes of emotion and then you search around to grab hold of an idea of why am I feeling that emotion? Oh, it must be because whatever thoughts come into my head.
Basically, every time you respond to one of these primal kind of midbrain emotions through a constructive action, you start to weaken the diversion pathway of suppression, and you enhance and strengthen your healthy pathway. And every single one of the 4,500 that we've treated, I know that's exactly what's happened. I just don't have neurological proof. When your hypothalamus is still overactive, exerting yourself does make you fatigued.
Yes.
It's a bit like having a broken ankle and walking on it. What we need to do is heal the ankle first, and then each time you do more, you benefit from it. I don't think our level of conscious control is at the level it might be as we evolve further. I think what's happening is there's a readdress in the human species, which is why chronic fatigue's gone off the charts. There's been a kind of imbalance whereby this has been far more powerful and dominant than this should be. I think a lot of these states are the rebellion between our body, which is controlled by subconscious, in my opinion, and the thinking brain. Because your primal emotional midbrain can shout out signals as much as it likes, but unless your thinking brain chooses to act upon them, nothing works. I think that was very promising. Kim's clearly grasped everything that is mycotherapy. He asked some very good questions. In fact, I didn't need to answer so many. He answered most of his questions himself, so it was very promising.
My first impressions, I think, well, they're good. They're hopeful. They're hopeful. There's a bit of me almost doesn't dare to hope. There's another bit of me which almost wants to weep with hope. You know, I'm 44 and yet I have the energy and life of an 84-year-old. So the idea I might actually get my life back it's tangible. It feels like, you know, he seems hopeful. A lot of it seems to make sense. It feels like it's kind of within the grasp, you know, and I just want it to be real. Hope, yeah. Daring to hope and not daring to hope at the same time.
Ha Behnlen, Kim agus Alison idir bhíad an cúngealacha go mór le ME idir bheora fatúne. A cha gnéitiach fullach ME an ga bhfuil an bé go manas misa.
What is often not realised is that probably about a quarter of people with this illness fit into a severely affected category, and these are people who are housebound, bedbound, wheelchair-bound, and they are, in many cases, just outside the medical profession's radar.
Va holly id unju seo. Va ME jora fat chechgarichet bliona as gewoonach roi kultuur kjurmach.
When I was 25, things got really bad in that I was out one day with my mum in a shopping precinct in Stockport, as it happens, and my legs collapsed. And I never really could walk unaided from then on. I was bedbound, pretty much housebound. Soon after that, I was issued with a wheelchair. So then ensued quite some years of severe symptoms. Blackout blinds, couldn't stand light at all. at worst needing to be fed, not being able to walk to the bathroom, you know, just hands crawling everywhere. Zimmer frame, the lot, everything that I needed. And looking back, I don't know now how I did that, how I coped with that. I mean, there were times, and I think, you know, a lot of sufferers feel the same, where you can't see an end to it. And that's when you start to think, well, maybe there's only me can end this, and you have some bleak moments. About the age of 30, my life circumstances changed a lot, and I became pregnant with my son, Shamey. So I was 31 at this point. I was absolutely overjoyed. Always wanted children, and, you know, never really felt that I would be able to do that, you know, with the symptoms being so bad. So my symptoms decreased, and I moved up to Scotland at that point, very, very happy, moved up to Skye, and new life, new start.
Ach a holi y cwmal ymach, y ganyan chotonas van emi eich gan dod I lees trachorag le lesach o Mikkel. Hij nestjer trainig na lesach hier, zij aarst aan de bujon en dochter Mikkel.
Over the years I had tried everything. I mean, down to holy water from wherever. You know, a friend of a friend said, well, try this. I tried everything. Magnesium injections, hyperbaric treatment, which was terrifying. Then I got an email from a friend down in London. He talked about a treatment called Mikkel therapy, a new treatment that a friend of his was embarking on, and he'd had a few sessions, and he was doing all right. He was responding.
Geta ha holi y galdish gyfel y dochter Mikkel y critsin gyfel bwnaid haiansel y eger son y lesachog, ha holi y brin I the lees eichgische an y brieren mar critju agus critias.
Well, looking back, you know, my faith was really strong in the process. I'd gone from, you know, using a wheelchair and a Zimmer frame to just using a stick by session 3, and I was walking, and I think session 3 I walked home, and I carried on with the treatment through till August, when I was symptom-free. Unbelievable now, even talking about it now, it seems ridiculous that you know, a talking therapy as it is could have that impact on my life, could be so effective. Ultimately, I have a pure belief that this is the only effective treatment at the moment. And so that kind of, I suppose, exudes from me, and people, you know, take it and get better. You know, what a great result.
Gaan je jarabig science aan, ach kemmer y gwythig y lesach o sio oprachog. Een dochter Mikkel, ha emi y buntin di achtet yn ynachyn farfel na ffadachgyn yn ochgwch. Mewn yn ynachyn as gaharat farach y hypothalamus.
Mikkel therapy is a process that's been evolved over 11, almost 12 years now, whereby we've understood, or we've based our hypothesis on the fact that someone has an overactive midbrain. Principally, the hypothalamus is overdriving their body. We then start to teach them that symptoms can be traced back to what the activity is in the midbrain. Principally, this is emotion that arises without any thought. So it's a primal emotional response to those situations that they're in. By doing that and helping them translate it back, we can then start to teach them that these emotions actually demand different actions or behavioural change in certain situations.
Handolof roed I cywi na haich geoliche ag olhain y bawri am y belferstio. Ha mi ydy fi yd hen agos y fen. Han oped ag ysteich dys bechgan smoan man ynachyn agos farachgyn. Agos gytnach y lecwyd o lan ywnt ydy lesach o Mikkel, he galdys gyffwtig e oped mar do I ddwrst.
David Mikkel's analysis that this is a midbrain problem definitely is very much in line with the way I see things. What David does is a talking therapy. We know that conscious thought processes can influence the connections that midbrain systems make. your conscious mind has the ability to shift balances in these systems. Perfectly reasonable that David is using that set of levers to try and shift these balances.
Hakadidu tishtinus and science alone gibel car like a hypothalamus the immergest ME.
We know that there are hormonal endocrine abnormalities in this illness, and that these probably relate to a abnormality in function in a tiny little part of the brain called the hypothalamus, which is a gland which sits below the top of the nose, deep inside the brain. It's only a very tiny little gland, but it's a thermostat within the body for controlling temperature, appetite, and it's the leader of the hormonal orchestra. So the hypothalamus, sitting there within the brain, sends chemical messages to all the hormone-producing glands in the body, and we know in particular the messages which go from the hypothalamus to the adrenal glands, which sit above the kidneys and produce cortisol, seem to be abnormal. So people with this illness have slightly low levels of cortisol, which is a very interesting finding, and one which is possibly amenable to treatment.
Hand on heart, I don't honestly know how exactly it works because the midbrain is such a complicated structure. But in our simple terms, what we say is that by teaching a client what emotions might have led to the hypothalamus producing the symptoms, then by backtracking to that emotion and learning what it seeks in terms of behavioural change or action, then you can stop it triggering the hypothalamus.
I am not sure why he settles on hypothalamitis. Gupta, for instance, talks about the amygdala. There's the flight therapy talks about the stress systems and so on. There are a lot of these midbrain systems, and I don't see a particular reason for singling out the hypothalamus. But it is fairly certain that some cases involve the hypothalamus. So in that sense, I quite agree. He's talking about an important area. Whether the treatment works, it is reasonable that it might.
In all honesty, I don't know if it's the hypothalamus gland. I don't know quite what it is, but understanding it can wait because the treatment in the process is working. So why not get on with it and treat people, get them well? Isn't that the priority?
This theory could be tested objectively, really quite simply, because we both agree that hypothalamic dysfunction is part of this illness. Now, you can look at hypothalamic dysfunction in a hospital-based investigative session. You could test the output of cortisol from one of the glands, the adrenal gland that the hypothalamus controls. You could do this before a course of Mickle therapy. You could do it after a course of Mickle therapy. And you would at least then have some objective evidence that Mickle therapy is influencing the way in which the hypothalamus functions.
Han dochter Mickle a kumalemach gebel sedevigers aan de 60% te goeschen. Kemmer hech o kindich.
Mickle therapy, because its results are based on client testimony, if you like. I mean, we've treated almost 5,000 people now. Our results are just a little under 80% who declare themselves to be fully well, which in terms of any treatment's excellent. But unfortunately, until there's proper, very, very carefully done research, I don't expect the medical community and certainly the larger government bodies of it to accept us as a treatment. I find that frustrating, but I can see why it has to be that way. Everything's evidence-based now.
My problem with all these talking therapies is not so much the cost of them, although some of them are exceedingly costly and some of them go up to almost £600 of your money, which you may not get back if things don't work out. It is the fact that they are often based on theories which are scientifically unproven, and I just wish they would come up with some proof to demonstrate that the way in which they feel their approach is working has some scientific basis to it.
In order to make sure that we had a consistent level of excellence in terms of delivery of this therapy, we set up a database at the back of our website for practitioners to enter anonymous detail about every single session that they did with a client, and that was then supervised by the supervisor. So we amassed a whole load of data on success rates, dropout rates, people looking for initially some interest but then not coming, and then we look at all the stats on a regular basis.
It's all collated, those statistics are taken constantly, so every therapist feeds back the statistics into the system so that it's constantly updated.
In terms of why we haven't been able to do anything with these results is because there would be too much bias. I mean, it's just us. We'd need to contact every one of our ex-clients who say they're better and ask if it was okay if an independent researcher contacted them. But the easiest way, and it doesn't stand for much, that really, to be honest, you have to have concrete evidence which is done through proper randomised controlled trial, rather than just observational retrospective stuff. But I've been trying to get that for 6 years now.
I would acknowledge that there is a problem in funding research into alternative and complementary therapies. Charities fund the majority of biomedical research in this area. We have a small pot of money, and funding research into something like Mickle therapy would not be top of our list of priorities when we feel there are more important things with the limited amount of money that we have to do to go into. I also have concerns about the way some of these therapies are promoted to the public in the websites and advertising material, which will often claim very high rates of success for these therapies, but these are based on anecdotal claims, they're not based on clinical trials. I think without some scientific evidence from a properly controlled trial, that is entering the area of exploitation of a very vulnerable group of people.
Han Dr. Mickle in de Carlach Allison had a shit grundviasen agus immertach session. Ich húsgefel essen an den lekin agus ish an the leos han a session in the galate had a she nitterlian. Skype.
What we should really be focusing on, you and I, is just about getting a better balance in your life, especially before you have another baby.
Okay, well, thanks.
Very nice talking to
And to you. Okay. Okay then, take care. Bye. She schon 3 session a vaking en och. Agus mi bakken stochenes. Nu var mi eken horsoch. Han oktor a gra en hruplatje små härsings mönjoch. Kamal en hinnes show. Gyfel a has dacem gynach am I tor georchidjung o hin. Gach la le rwydyn hadjan y tolach ys nhw agos gyfel cws rwydyn awn a hana woloch agos gyfel a fiach yr I canti reim gyffeim I fi cyd rwydyn awn a ha jan y ffeim nhw hin sa'n ysyn fferus na ddysgu ben agos ma had agos ha rwydyn mo siwn a mi smynioch rwyd ha tordoch ys nhw fo yishang nhw na nywchlichen y ymach mi clachgach on via Milanacher ha mi smynioch na de horsich mi smynioch in de routensche agus gan chlacht mi an va mi finken guru routig en ekke en de laichen va ma agam is na laichen nach ro agus na de chal mi raas va voet de weke e geuntiger e kamene dus nu roet me zat back o hoorde gaan rine symptoms van mi vader ge dus lesjen ha mis me ook wel wat ik is een bjach en ha gies ik en hoorsoch waar met jou gra wel gaan je shot aan een peak fame kimmer soering show wie ach haishing mish nocher agus ha gra nach wel nach I rwyd yn môr y iemes y fi iawn, y iemes mi aharach na ma fi, ach rwyd yn byg, nach I chantach da hyl, ma sad bynt fys ciawn, ach di ach rwyd yn byg y iemes dy gobydd e, ys len y rwyd yn byg yn ysyn, gydych at Jan y Jiffer môr, sa eisiau gyda, gyfel eisiau smynioch, gymwri mi, fi palanc I o'r, ledri o'ch na rwyd yn byg ysyn. So na ddechlwyn ysd y dyn gyda ysyn, dyn, Wel ha, tord hwt mis nog. Wij stok wel kwijtje, kwel zijn fydd.
Handolf Peter Behan de griachgelijke schechat maar eolige neurology. Ryn griach kijk hospital Southern General aan de glassige enjamale het figurd hugel maar eolige een mater boekjoch ek MI. Rene kutjoch na gochter zich geologisch ek al hij Harvard. Hij is genele ietje de kundige die lesse goed mikkel.
I've come across it along with many, many other similar theories, and the person putting out the theory may offer advice and forms of treatment and make some money out of it. But other than that, I doubt if I've never seen a patient to be cured by application of any of these practices so far. There's an essential biochemical or molecular component to the illness which needs to be elucidated, and research should be along the grounds into these illnesses rather than dealing with psychological talk-to-talk nonsense. I have not seen any form of cognitive therapy or talking therapy to be of any value. I'm not saying that if someone who is in authority and who offers you warmth and kindness and who's authoritative in what he says won't have an effect for the benefit. It will. But the answer that it's the cure, I'm afraid, is wishful thinking.
Ga je dochter Behan saas aan een MI om nog te kook, door hoe kasoel van de darne oud de hier Charlotte Clarity en Tinnis at je Royal Free Hospital aan de Londen dicht bij de ficht naar patreien aan de kookje te kook. Hoe kan op je crew aardig weer een dag het wil je kijken de Tinnis en de wil MI in est.
Now the Royal Free Hospital was of particular interest because technicians, medical students, doctors, nurses came down with an illness which could not be explained. And unfortunate for these patients, they were examined by a psychiatrist and a medical student. And they came to the conclusion that it was mass hysteria. It was somehow a psychological disorder that had a contagion factor. So I wondered what had happened to these patients who had been involved in this outbreak. So I got these patients, collected quite a number of them, and we were able to have them come to Glasgow, and I investigated them in Glasgow. We carried out each and every type of investigation to see if we could find an abnormality that would demarcate these cases. With the exception of one patient, they were all entirely and absolutely healthy and normal individuals. These were normal individuals who still had the most overwhelming fatigue, who had abnormalities of sleep and the other non-specific complaints, and had had these all these years and never got better. We tested these patients for immune abnormalities. We tested them using the most sophisticated techniques, namely polymerase chain reaction studies, looking for enteroviruses that had a tendency to involve muscle. And the first abnormality that we were able to hang our hat on, so to speak, was my wife, or late wife, who was the professor of pathology here. She noted that the mitochondria, the organs dealing with energy production in every cell, that they were abnormal when you looked at them histologically on electron microscopy. So that was one abnormality that we found. And the second abnormality was, we had a patient with a classical syndrome following chickenpox, and we had him analysed at Oxford University by Professor George Rada, and he showed that the patient had an abnormality of muscle. This abnormality of muscle was very interesting in that when he was tested at rest, his muscles were normal. But once he started doing exercise, then within a very short period, he switched from aerobic to anaerobic oxidization.
Sé tealach Shepherd banyam gan dochta dog a huad cór van nolov bihan.
Like many doctors, I thought this was either a non-existent illness or was all hysterical nonsense. I was at medical school in the early 1970s. I was taught by my superiors that this was in actual fact hysterical nonsense, and some psychiatrists at the medical school I worked at had actually produced a paper on this, and it was published in the British Medical Journal. And that is partly why many doctors, certainly of my generation, have believed that this was an illness which either didn't exist, or was hysteria, was malingering, was all in the mind. And that was my view until I actually went down with a dose of ME, and it took a succession of hospital visits over probably a period of a year with no management, no diagnosis. And it was only actually when I saw Professor Peter Byrne in Glasgow that I got a diagnosis of this illness.
It became abundantly crystal clear that several patients had developed the syndrome, the identical syndrome, but they had developed the syndrome not following a viral infection or another infection, but due to their reaction to a particular form of stress.
Agus déha gyfrach o oolach mar seo. Rwt sy bych a fôr, agus yr an olaf bihan over saich geolish.
Surgical studies show that patients after certain forms of surgery can have it. And of course you can get a chronic fatigue syndrome after a stroke, post-stroke. So all of these fit into the paradigm for diagnosing the condition and considering it. So the syndrome, the term post-viral syndrome was not, we felt, appropriate. It was post-stress syndrome.
Mar rhain, yn ia tynys corpora ydy öfrach le oolach saich geolish, no mir ian farach gynyn y gwydwch tynys dioi virus. Nega, no gynnidyd.
I think one of the most important phrases in this area is, I don't know. And I think anyone who claims to have a clear understanding of what happens when someone goes into an ME state really ought to think twice. The complexity of brain systems is really quite hard to grasp, and you can give it in terms of numbers roughly, that there are somewhere around 100 billion neurons in your brain. What you have here is a set of interconnected, incredibly complex systems which are always engaged in this complex balancing act. That's the way biological systems work. And the idea that something could go wrong with that system is so shatteringly obvious that no one should have any problem with it. The amazing thing is that it works at all.
Ach gaan jullie goed in je kundige te kobrige ME. A look volk, dochteren, als look langsje gematrich genoegen in de gele, gepersente, agus go politikach.
The political environment surrounding ME is a shark-infested water. There are so many different theories underlying what causes ME that it's become a confused environment, and it's really unhelpful for sufferers principally, but also it stops people who could looking into the condition further because there's too many different angles. So in terms of research and the discussions around it, I think it's just making life as a sufferer of ME worse.
It's a very, very emotive subject, isn't it? And it's been going on for many, many years now. And you know, at times I despair because it feels like we're getting no nearer to a consensus of opinion of what it is and how to treat it.
The situation around ME is very divided, and there are confrontations and so on. And to some extent, I think that is a fairly typical thing that happens in science, that you get people taking strong positions. It's not terribly clear who can sort of negotiate understanding between them. There's nobody whose job it is to calm the water and say, look, you know, you're all essentially allies.
I don't know why it's like two kind of poles that can't kind of come together on, you know, an agreement of what it is and how to treat it. And it's a little bit like the three blind men, you know, they're touching different areas of that elephant and describing that as a single area of that body, but they don't know what it is as a whole. They're not seeing the whole.
By looking at the politics of this, I think we have to start off by looking at the fact that we have 250,000 people with this illness in the UK. The vast majority of those people do not get involved in aggressive politics or aggressive activism. A large amount of those people, I feel, are fully justified in feeling angry and frustrated, not only at the lack of research into the underlying cause of this illness, but the fact they don't have services, they don't have hospital-based services, they may not have GPs who know anything about this illness at all. So they have very justifiable complaints about the way the system has treated this condition. On the other hand, we have a tiny minority of people who have taken this anger to what I feel is an unacceptable limit. This whole issue of intimidation and death threats and whatever is not new. It's been going on for some time. I have personal experience of it over the years. I have received some very offensive and unpleasant mail. I've never actually received a death threat, but I have on 2 occasions actually had to contact the police because of the threats I've received, because people don't always agree with my opinions on this disease, so I know what it's like.
Se skriver at den egen han nasim. Hij vi fullokle MI koros ochkerichs bliona, sei novel en jammel skriver na hacheri. Hij trichke gal parstas na jespet leine mo MI. Hij sei heen in de vierde moeier.
I think the reason that ME debate, especially now that everything's online, it's like a war zone, and it is, there's no doubt. It's not just the neuroimmune versus the psychosocial or biopsychosocial. Patients are at each other's throats, different, you know, people have allegiances to one doctor and not another, and people haven't been believed, they've been misrepresented, they've almost been ridiculed in certain ways, so that's where all the fighting happens.
My own view on some of the people who go to this very extreme measure is that they may well have a mental health problem and don't even have ME. Part of the problem with this illness is that we have people who are self-labelled as having ME because they cannot find any other explanation, or doctors are unwilling to give them some sort of explanation for their ill health, and they label themselves as having ME. And a very small minority of this particular group, I think, do go on to campaign, if you like, in a very aggressive fashion.
Leis na hawn de jeffer wechgen mo hem al over agus koor. Kemmer op goor rausig oorstig.
Biomedical research. Take psychiatrists out of the equation. Let psychiatrists study psychiatry. Let neurologists, immunologists, virologists, let all those good people study ME.
Ach Katja Fakushen, Dr. Mikkel.
I am completely perplexed as to the lack of political will, considering the number of people with ME, to look at alternative treatments, whether it be Mikkel therapy, Gupta program, any of the other things that are there that are declaring success. It's a bit like doubting Thomas, isn't it? I mean, they should embrace it and have a look at it. And even with the might of the ME Association, who do great work, they're not listened to. My voice isn't going to be either. And I don't know why.
I think where people with ME have a very justifiable complaint here is that this is an illness which is affecting, as I say, 250,000 people. Most of these people are moderately to severely ill with this. They've had to give up work, they're relying on benefits. It is costing the country at least £3 billion per annum. To say that no money, which is the position up to now, should go on to biomedical research is unacceptable.
Het doel aan voor aan de wijanurangsige tinnis maar MI. Van gelach een bekte gunte aan de wilorak over agus langsige tinnis.
One of the big issues in any kind of research project is sitting down, looking at the preliminary information you have and deciding on the structure of the trials you need and the number of trials you need, number of cases you need. And what seems to be the case, as far as I can see in ME, is that you have a large number of related but different conditions, and we have no clear idea on the boundaries between them.
The only way that we are going to fill in and complete this jigsaw puzzle is, in my view, really quite slow and painstaking research in all these different avenues. I do not think that we are suddenly going to have a major breakthrough discovery which is going to fit this magic, almost magic large piece of missing evidence into this picture. It is going to be a slow build-up on what we've already established over a period of years. But I am confident that we will eventually get there.
The only thing that's really important to me now is the goal of getting randomised control trial done on mycotherapy against the current recommended treatment. Now, the steps towards that I take lots of advice on, and I'm always advised that can take quite a long time, and these were good advisors because it certainly has, but I've started, so I'll finish.
Son een goedje session echtje, han Dr. Mikkele Schule de Ascheleus son kunjige gepersonte die Allison. Han je sjok krieg een hoor echtje, ach een ferme jedig moest je krieg de filmig akkenje.
What I was going to do is do a little recap about what we've spoken about on a few occasions.
Okay.
And then we'll start to look, mainly I want to speak to you about the key 3 element of the treatment, the balance. So I think that's going to be particularly important when you have your V1 plus donor.
Leisure trapelen dat raim mi mycotherapy had raim mi 3 koersigen. Agus gaan je leisure doctor va hamis mi ook wel treffer raam een trapsho. Han je leisure mi schens kun je dokter han mi hins mi ook kun je wel me kut pakken var ook arabsan. Soringa bring me in hinjes. Uit roten chemechel en hinjes. Aan zijn narsien ook. Stoog nach boering. A therapist. Agus leisure, you know, ha tort mo barch tiks. Tor barch tiks. Nu wakke me hietrap. Again nede ilja safi achrigianu agus. Injelen klachke ga tort ju de son. Give me, you know, if I the launch a rash. Reisen gran. Nach I sláint a hat hollerút a hat och hútechu fan go I the sláint nach roaid.
You understand the importance and the difficulty of being true to you.
I do.
And we're just going to work at ways of looking for opportunities where you can practice that.
Hake natuurlijk, or a siege hake me naar rast, wie na me ween, agus, wie na me wahat, agus, gewelke ma dulige wie tot chije uteen ham so kan je schon gene wonen gemich mistoch tot ben hulde dingele agus nach rom mistoch tot mi hin ham so wel hat je een feme wie bring die dokter Mikkel kujoch no smeunjoch hede in hinjes agus skuplich in je maag dat ha Nenich in Smith, they ha gerberach, in hinjes of in Smith.
I was quite encouraged by that session. Alison's clearly got a good grasp of the mycotherapy process, She's got some situation going on, you know, being 32 weeks pregnant, having a toddler child, that make applying the full principles quite difficult for her. And as we spoke about about balance, etc., I think the future plan best would be that I follow her all the way through till she's had her baby, and then really put in more input after that point, because that's when things will be clearer for her, because life's going to go through quite a significant change.
Le fi fein taich car imitach mias, a kim yn ysdi fadach yn gyfler ti'n co criach later as a choreke.
Basically, I've had about, I don't remember whether it was 5 or 6 sessions, but it's 5 or 6. And I'm pretty much at a stage of, well, completion in some ways. There's no doubt the therapy's had a big impact, which I wasn't sure was going to beforehand. You know, the whole thing's surrounded in mystery and controversy, and you know, you get to a point where you think, well, I've kind of got nothing to lose.
Throughout the treatment I've had with Kim, which has been a number of sessions, I think we may have had 5, I was very pleasantly surprised to see the progress he had made by basically session 3. He had taken on board the whole principle of how mycotherapy works in terms of translating symptoms into emotions and then finding appropriate actions using the keys. And he made a much more rapid recovery than I had initially assessed when I first met him.
Maybe it is just some kind of, you know, mental health issue. But maybe it is for everybody. Maybe it isn't for everybody. I mean, I can only talk about my own experience. The fact that I've been released from the fear of it, and the fear that that side is going to, the fear of my mind causing that to happen again. I'm free of the fear of depression dominating my life again. That I won't have to take pills and happy pills and, you know, be on antidepressants, and I now have a solution to that, and that is so powerful. I'm not 100%. I don't know whether 100% is ever likely to be. I don't know whether I was ever 100%. I mean, you know, what is 100%? But the fact is, I am a lot more functional.
I assess Kim as not completely finished with the treatment yet, but very, very close to what I would call successful treatment and a well individual again. He's describing to me activities that he wouldn't have imagined being able to do when I first met him, and I'm absolutely delighted.
I've pretty much come to the end of what I need to learn from Dr. Mickle. Would I say I'm cured? No, because cure is the wrong word. It's not about having a cure so that you can go back to who you were before. It's about changing your relationship so you go into the world in a new and improved way, really, in a way that's better able to handle it. Now I would say I'm back at a place where I dare to hope. It's really good.
Ha mi dóchasach ge mi min siar achlachgus min rutan hagra raun. Or ha mi ni vi na siar fu hin mi asich yn hani do siachad agus gahona sin chanyelisam hanwrino gydag y ceidio ach gyfeil cwys yn y siar.